The primary prevention of cardiovascular disease, what guideline says, cardiovascular disease is referred to a class of disease that involves the heart, blood vessels, including conditions such as myocardial infarction, stroke, and coronary disease. Preventing CVD is crucial for maintaining heart health and reducing risk factor of the life-threatening events. हाउ टू प्रिवेंट कार्डियोवास्कुलर डिजीज, ये सबसे बड़ा प्रॉब्लम है कि आपके कार्डियोवास्कुलर डिजीज को प्रिवेंट किस तरह किया जाए. एज वी नो दैट द ट्रीटमेंट ऑफ कार्डियोवास्कुलर डिजीज इज़ वेरी वेरी एक्सपेंसिव, और स्पेशली जब इंटरवेंशन में आ जाए तो पेशेंट का जो है ना वो कभी कभी घर बिक जाता है, कभी चीज़ें बिक जाती हैं, और उसके बाद 6 महीने बाद दोबारा आता है कि जी मुझे तो स्टेंट बंद हो गया. तो हिसाब से बेटर कि वी शुड डू थिंग्स हाउ टू प्रिवेंट कार्डियोवास्कुलर डिजीजेस. टू प्रिवेंट द कार्डियोवास्कुलर डिजीज नीड टू 5 की थिंग्स that make them into habits. Don't smoke, maintain a healthy weight, exercise, be active, follow a healthy diet, and improve sleep health. Primary prevention of cardiovascular disease is minimizing and avoiding as many as possible risk factors and adopting lifestyle. You know that the prevention is better than cure. एक परहेज 100 बीमारियों को बचाता है, लेकिन 100 बीमारियां एक परहेज से दूर हो सकती हैं. सो व्हाट आर द प्राइमरी प्रिवेंशन ऑफ एथेरोस्क्लेरोसिस डिजीज एफर्ट्स क्या हैं? द प्राइमरी प्रिवेंशन ऑफ कार्डियोवास्कुलर डिजीज में मेन थिंग इज दैट इट इज पेशेंट सेंटर अप्रोच. मीन्स वी हैव टू टेक द कॉन्फिडेंस ऑफ द पेशेंट into account while you are asking for the prevention, because prevention cannot be done unilaterally. It has to be done bilaterally. Means you have to involve the patient and his family in the primary prevention. Lifestyle modification is the most important factor in preventing any cardiovascular disease. Controlling risk factors like nutrition and diet, physical activity and exercise, overweight and obesity, diabetes mellitus, hyperglycemia, hypertension, tobacco and aspirin use, जिस पर अभी हम बात करके आ चुके हैं कि सेकेंडरी प्रिवेंशन में yes there is no doubt about that thing, using aspirin is there, but using in the primary prevention it is still debatable. I told you that it is always a patient-centered approach, and it is the level 1 confidence of the class 1 indication that the prevention should be started with the patient and his family. And it is said to be that it is a team-based approach recommended for the control of risk factor associated with atherosclerotic heart disease. Shared decision making should be done, and social determinants should also be keep in mind while asking the discussion or while discussing the prevention of the cardiovascular disease. So for that matter, you know the example for consideration of addressing these are cardiovascular risk factors, adult diet, exercise, obesity and weight reduction, diabetes mellitus, high blood pressure and tobacco treatment. There are certain factors which you cannot prevent, but there are all other factors which can be preventable. If we are preventing the disease, means we are preventing the cardiovascular diseases. How to assess the cardiovascular risk factor? It is class 1 indication that from 40 to 75 years of the patient, we must assess every patient for the possible risk factor in the last 10 years. And depending upon the percentage, you have to adopt the certain measures to avoid the cardiovascular problems. Then in adult, this 2A indication from the age of less than 40, that you must see that what measures should be taken in preventing the cardiovascular diseases. The other factors which are risk enhancing for disease which should be taken into account, जैसा कि कौन कौन और रिस्क फैक्टर्स हैं जिस पे हमें डिजीज बढ़ सकती है. फैमिली हिस्ट्री, प्राइमरी हाइपरकोलेस्ट्रीमिया, मेटाबॉलिक सिंड्रोम, chronic kidney disease and chronic inflammatory disease, which I have just discussed a bit right now. The other is what history of primary menopause. In females, we are lacking in assessing the cardiovascular problem because there are multiple factors. So early menopause is another factor in having the cardiovascular problems. High risk race and ethnicity, lipids and high cholesterol levels, elevated high sensitivity, elevated LP, all these and we just described. I am not going into detail of all these things. So after having the patient-centered approach, that is the main thing which you should keep in mind. The lifestyle modification is the main factor. And the nutrition diet, again, it has the class 1 indication, a diet emphasizing intake of vegetables, fruit, legumes, nuts, whole grain, fish is recommended to decrease atherosclerotic risk factor. Means in the diet, everything should be included in a proper setting, in a proper percentage to avoid the cardiovascular disease. This is the class 1 indication. So the harm is that as a part of a healthy diet, the intake of trans fat should be avoided to reduce the atherosclerotic one. Means the animal fat should be avoided and the vegetable fat should be encouraged in preventing the cardiovascular problems. Exercise and physical activity. This is a dilemma in our Pakistani population. We do not exercise. As far as me is concerned, in my clinic, I've seen and I've asked, I always ask the question, how much do you walk? In males, more than 90% they do not walk. In females, 99.99% female do not walk or don't have the proper exercise. वो सवाल क्या होता है जी, हम घर का जो काम करते हैं वो हमारी एक्सरसाइज है. जो मेल्स पे कहते हैं जी, मैं अपने ऑफिस में या क्लिनिक में या कहीं पे भी काम कर, जो चलना फिरना होता है वो एक्सरसाइज है. दे डोंट नो कि प्रॉपर एक्सरसाइज शुड बी देन एंड वी हैव टू एनकरेज द फिजिकल एक्टिविटी इन आवर पाकिस्तानी पॉपुलेशन. Definition of life in exercise intensity, that the meds depends, will definitely give you an idea how much the person is active or inactive. If it's a sedentary behavior is less than med 1 to 1.5 and it's a good exercise, if it's or rather vigorous, if his med is more than 6, and in between 1.6 to 0.9 is light, and 3 to 5.6 meds considered as a moderate exercise or active person. The other factor affecting the cardiovascular factor are adults with overweight and obesity. The weight should be according to the height, according to the age. And the obesity means when the BMI is increased and health risk ratio is also increased or disturbed. It is a class 1 indication that individuals with overweight and obesity, weight loss is recommended to improve the atherosclerotic heart disease. Means everybody has got should have the weight according to the age and the height. And counseling and comprehensive lifestyle intervening, including caloric restriction, are recommended for achieving and maintaining weight loss in adults with overweight and obesity. This is again class 1 indication. Again, the calculating body mass index is recommended in annually or more frequently to identify adults with overweight, obesity, and weight loss consideration. This should be done in all patients, and this is called the class 1 indication. Now, the patient was not diabetic. If the class 1 indication for the diabetic is, with all diabetes, type 2 diabetes, a tailored nutrition plan, means the diet and the exercise, is the class 1 indication in maintaining the diabetes and controlling diabetes and preventing the cardiovascular problems. Adult with type 2 diabetes, is to be said that they are just having the exercise, it should be about 75 minutes per week. Vigorous means running, and they are having the brisk walk, it should not be less than 150 minutes per week. In class 2, indication for adult with type 2, it is reasonable to initiate metformin as a first line treatment, because the metformin is one of the oldest drugs in controlling diabetes, and it has the least side effects, so it can be used. But if the patient has got some kidney problems or renal problems, then it should be given with a caution. Diabetes specific enhances that independent of the risk factor include are long duration. Depending upon the duration of the diabetes is another risk factor. Albuminuria is another risk factor with the diabetes. Decreased GFR is another factor which you have to measure in diabetic patient. Retinopathy is the first indication of any cardiovascular or cerebrovascular disease involvement. Neuropathy and ankle brachial index percentage should be checked in all diabetic patients. As the treatment is concerned, I am not going to detail the treatment because of the short of time. the treatment should be tailored and according to the guidelines. It means that controlling the diabetes means we are preventing the cardiovascular event, or at least you are delaying the complication of cardiovascular or cerebrovascular problems. Now, the adult with a high blood cholesterol, class 1 indication is that in adult with intermediate risk, according to 7.5 to 20, 10 years atherosclerotic heart disease, statin therapy should reduce the risk of atherosclerotic cardiovascular disease. And in the context of this discussion, it should be said that the cholesterol high with other risk factors, sedentary lifestyle, smoker, and diabetes, they must be put on the statin therapy. Again, this is class 2 indication in intermediate risk. From again, LDL-C should be controlled with the statins when the patient has got the other risk factor as well. Again, this is a class 1 indication from adult in adult from 40 to 75 of age with diabetes, regardless of estimated whether they should have moderate intensity lipid or statin therapy. It is again a class 1 indication in patient 25 to 70 with LDL-C more than 190 or higher. Maximum tolerated statin therapy should be recommended. It's not the 5 milligram or 10 milligram or 20 milligrams according to the maximum therapy which can patient tolerate should be given. Adult with, again, this is 2A indication in adult with diabetes mellitus and in the intermediate risk, they should be again on the cholesterol reducing therapy. So, the other with recommended dose for high blood pressure in patient with borderline risk factor, major factor is again diet, exercise, and statin therapy. How to prevent the treatment? Again, you have to. It's a long list of treatments. So I'm not going to detail that one. High blood pressure is a major factor, and you know that this is the risk factor which it has got no symptoms and the symptomatic disease, and this is the treatment of the hypertension is very difficult because of the symptom disease. So it is a class 1 indication. If the patient is hypertensive, his or her blood pressure must be controlled. How you can control? Healthy dietary pattern, sodium reduction, dietary sodium supplementation, increased physical activity. The recommendation with that high blood pressure is again you have to control the blood pressure, keep the blood pressure 130 by 80. If the diabetic is lower, is better. The treatment of the blood pressure is again tailor-made according to the individualized, and you must treat them with the compelling indication, non-compelling indication. It is treated according to that one. I'm not going to detail of the non-pharmacological treatment of the blood pressure. It should be controlled. All these risk factors you can keeping in mind. Controlling those ones, they help in controlling blood pressure as well as the weight reduction, salt reduction, exercise, stop smoking, controlling the hip and waist ratio. Tobacco use, which is increasing day by day, again is to be said that it should be curtailed and at least it should be reduced, or if anybody is not able to control cannot stop the treatment, 1 minute more. 2 minutes वैसे ज़ाया हुए थे मेरे पहले मैंने कहा था. Okay, so I'm going skipping few slides. Aspirin use, I just discussed. Secondary prevention, no doubt about that thing. And primary prevention is still controversial. So that shift and take home message. The most important way to prevent heart disease is atrial fibrillation is to promote a healthy lifestyle. Team-based treatment should be given. Adult with must be calculated atherosclerotic heart disease of the 40 to 75 milligram. The fourth one is should have healthy diet. Should engage at least 150 to 75 minutes of exercise per week. Type 2 diabetes, lifestyle modification, improve dietary habit and exercise. Should be assessed for tobacco use, should not always should be stop tobacco. Statin should be given. Aspirin should be given according to the primary and secondary prevention. And non-pharmacological intervention should be taken as the first line of treatment in prevention. And you all are invited for NCPC 5th August 2013 at Medical Hospital, Karachi.